Thank you for participating in Honor Your Body. Today we will be focusing on critical awareness. So what is critical awareness? Someone with critical awareness is able to challenge both scientific and cultural assumptions about weight and height. They are also able to value body knowledge in people's lived experiences. Let's go ahead and look at some common misconceptions regarding health and weight, where one may need to use their critical awareness. Please pause the video and select all that are true. If you selected all 4 statements, good job! It may surprise you to learn that on average, people categorized as overweight live longer than people categorized as normal weight. It also may surprise you to learn that size does not determine health, and health is more than just weight, diet, and exercise. Next, we will look at different aspects that affect our health. We see a lot of information about nutrition and exercise. One common misconception is that if you eat better, you'll be healthier, and if you exercise more, you'll live forever. The truth is, there's more to health than just diet and exercise. Maintaining health involves balancing each of these aspects in a personal and individualized manner. It's important to keep in mind that there are limits of lifestyle change on health. For example, you might be following the paleo diet and exercising and overall eating nutrient-dense food. However, you might be feeling really stressed out and deprived in trying to follow the diet. Therefore, is it healthy? Given that emotional is an aspect of health, emotional health may be compromised when we put too much focus on other areas. One well-known concept that may receive too much focus is BMI. What is BMI? It is a screening tool used to categorize individuals into one of 4 primary categories: underweight, normal weight, overweight, and obese. In its most simple form, BMI is the ratio of height and weight. With that being said, can you tell just by looking at someone's height and weight to determine if that person is healthy? The answer is no. Then why is it used? While it has become the norm to use BMI as a health measuring tool, it cannot define or predict one's health or wellness. The tool is primarily used because it is easy and inexpensive. One study examined the healthy obese and the unhealthy normal weight populations in order to see just how accurate BMI as a proxy for health is. The study identified 6 different risk factors for cardiometabolic health and included subjects in the unhealthy group if they had 2 or more risk factors. The study found a substantial proportion of the overweight and obese population at every age who were healthy and a substantial proportion of the normal weight group who were unhealthy. Psychologist Deb Burgard examined the costs of overlooking the normal weight people who need treatment and overtreating the obese people who do not. She found that BMI profiling overlooks 16.3 million normal weight individuals who are not healthy and identifies 55.4 million overweight and obese people who are not ill as being in need of treatment. When the total population is considered, this means that 31% is misidentified when BMI is used as a proxy for health. You're probably asking yourself, what does this all have to do with my body image? Let's go ahead and see how something as simple as the ratio of weight and height can affect your body image. Since you cannot change your height, individuals may try to change their weight in order to be categorized differently. When people go on a diet to try to lose weight, their body actually has physiological mechanisms to fight back in order to survive starvation. So, while weight may come off when an individual first starts dieting, weight is almost always regained over time. Along with weight gain, there are other consequences related to dieting. Dieting may also lead to weight cycling, increased risk for osteoporosis, chronic psychological stress and cortisol production, and anxiety about weight, eating disorder behaviors, stigmatization and discrimination against fat individuals, and weight gain. In 2012, researchers at UCLA compiled the 20 best and longest weight loss studies and researched the changes in weight that occurred. In the shorter studies, that lasted only 2 to 3 years, subjects typically lost anywhere between 0 and 10 pounds. The longer the study, the less likely the subjects kept the weight off. For the longer studies, there were significant dropout rates and participants weren't able to keep the weight off 8 to 10 years later. Not only do diets usually not work, but they also have many harmful side effects. So if diets don't work, should we encourage people to be healthy by losing weight? This is where health at every size comes in. I'm sure most of you are used to the Healthy Lifestyles team saying something about health at every size. Well, this is what we're talking about. Health at Every Size promotes a non-diet approach. The health at every size paradigm is about taking the focus off of weight and putting it back on health. It also promotes paying attention to hunger and fullness cues to guide eating, finding pleasure in food and satisfying cravings. This non-diet approach encourages movement, not to lose weight, but to engage in physical activity because it feels good and has many positive health benefits. In taking the focus off of weight, the health at every size paradigm involves promoting a positive body image and seeing weight and body shape or size as another key component of diversity, just like body height, skin color, and hair color. Although this approach is still relatively new, there is supporting evidence that exists. In research done at UC Davis, obese female chronic dieters ages 30 to 45 were randomly assigned to either the Health at Every Size intervention or a traditional diet group intervention. It was 6 months long, and data was also collected immediately after the intervention and at the 2-year follow-up. The diet group learned how to keep food records, read food labels, and were taught an exchange system for making modest decreases in calories and dietary fat. They were encouraged to walk, and benefits of exercise were discussed. The non-diet group learned about body acceptance, how to tune into hunger and fullness cues, eating for well-being instead of weight loss, and choosing activities that were enjoyable. Participants in the diet group experienced weight loss, improvements in labs, and improvements in different psychological tests, but all of these changes returned to baseline at the 2-year follow-up. In addition, 41% of the participants didn't even complete the 6-month intervention. The participants in the non-diet intervention had significant improvements in depression, body image, and self-esteem that was maintained at the 2-year follow-up. They also witnessed improved total cholesterol, LDL cholesterol, and systolic blood pressure at the 2-year follow-up. All of these positive results occurred despite the fact that there were no significant changes in body weight. Plus, the non-diet group experienced an 8% dropout, much better participation than the diet group. So what does all this mean? Perhaps this means it is time to question the way we think about health in our culture. Although society has historically focused on weight as an indicator of health, the previous study shows that the non-diet approach results in health improvements without weight loss. Please complete at least one of the following challenges.